Now that isn't what we call an OQ45 that you filled out for us, okay? So basically an OQ45, it stands for an outcome questionnaire, and 45 because there's 45 items. Now essentially that just sort of covers all of sort of daily stress, you know, and there's some pretty tough questions in there as well. And essentially we use that as a bit of a marker to see how you're going at the present moment. And what's useful about this OQ45 is I'll get you to fill it out at the beginning of every session. And what we'll do is we'll be able to track how you're going. So we would hope, as we get into therapy, you know, in our sessions, that we would hopefully see improvements in that. And so as we go, we'll always give that feedback in terms of how we're going, and hopefully we'll see an improvement. And if we're not, we can sort of look at adjusting what we're doing to ensure that things are going okay. Do you have any questions about that?
No, I think it was all right. Like, it hit home like quite hard actually. Like some of these ones.
Anyone in particular?
Just the fact I'm blaming myself for everything.
Right.
But yeah, you know, just finding it difficult to concentrate and you know, find pleasure in things.
Sure.
Yeah.
Yeah, no, it can be quite difficult looking at that in the first instance, absolutely. And Peter, as I go along today, I'll be taking notes, and essentially that's just for me to keep track on what's going on for you. So when you're talking, if there's something that comes up, I'm just taking a note to make sure I remember, essentially. Okay. Is that okay?
Yeah.
Excellent. All right, well, I'll grab that OQ45 off you.
No, it's all right.
Yeah, that's fine, mate. That's fine. So yeah, so you're happy with that response?
That's correct.
Yeah.
So.
No, that's not a problem. Brilliant. Okay, so we've sort of outlined some of that housekeeping, and to give you an idea of how we go in these sessions, because you know, as you said, it was the first time you've been here. It's kind of 3 phases, right? So the first phase is about information gathering. So hence the OQ45, and today I'll be asking a number of questions about what prompted you to come along. And that sometimes can take a couple of sessions. After that first phase, we go into that second phase, which is all about trying to put an action plan into place. Now, we'd love to start with some of those strategies today, I know. Unfortunately, it's a case of, in order to help with the problem, we really have to understand the problem. So before we get into that phase 2, we need to get a good understanding of what's going on for you at the moment. And then after that, we get into phase 3. And phase 3 is about trying to look at a process of gradually sort of stopping having to come along to sessions, and starting to look at what potential future obstacles might come up, and what sort of strategies you might have in your toolkit that you can draw upon to use in the future. Alright, so we're in that phase 1 sort of stage at the moment. Is there any questions about that at all?
No, I suppose like I want to know when I'm going to feel better, but is it too difficult to say at this stage? You know, how many sessions I have to come for, because GP mental health care plan only goes for 10, I think, and then you know, I don't have much money, so.
That's a really good question, Peter, and it's one of those things where it kind of depends. You know, we'll get a sense of what's going on for you at the moment. One of the things that we do know is that you know, there is a lot of good evidence supporting some of the therapies we'll be using, and hopefully after a couple of sessions we can start to see a little bit of improvement, because sometimes just talking about it is beneficial in and of itself. But then after we start to implement some of those strategies around what's going on for you, we might hopefully start to see some benefits. So in order to say it's going to be this many sessions is really difficult. But you know, typically in order to get a good sort of perhaps go at what's going on, we kind of do need a number of sessions. But as I said, we'll track this as we go. We'll see what's going on, and when we get to that 10th session, we can review and work out what it is we'd like to do. Okay.